Dr. Jeff Shay, and I'm an interventional radiologist.
Scott Shay, Interventional Radiology, Interventional Neuroradiology.
And you are twins.
Yes.
Correct.
Meet Scott and Jeff Shay, twin brothers who originally hail from California, both Navy veterans, both doctors who practice the same medical specialty right here on Guam.
Yeah, I think we had a lot of parallels growing up, and the fact that he came here a year before I did at Guam, and he really liked the multicultural environment here, the proximity to Southeast Asia for travel opportunities, the weather.
We do have there are some differences personality-wise, but for the most part we're very similar, to include interests, avocation, sporting interests, and then in the professional arena, like I said, because he was so excited about it, I figured, well, I think that I'll probably find it equally, challenging and exciting.
Dr. Scott Shay is a staff physician at GRMC. His brother, Dr. Jeff Shay, works on the Guam Radiology team. Both have recently begun working together, conducting joint operations here at GRMC.
We've done 1 or 2 aneurysms here at this hospital together, approximately in the last maybe 2 to 3 months.
Interventional radiology is among the disciplines at the forefront of modern medicine, where camera-equipped catheters rather than scalpels are the preferred tools. And instead of cutting open a patient, physicians are guided to the source of a problem by images taken inside the body and then projected on the kinds of high-resolution screens found in GRMC's cath lab.
The trend in the 21st century is to do procedures in a less invasive fashion so that patients have less risk and they can recover more quickly. So in radiology is one of the more dynamic fields where there's a lot of change and a lot of innovation. And when I saw some of these procedures as a first-year radiology resident, I was very impressed.
The latest case the two Shays have worked together on involved placing a stent into one of the neck arteries of a man who had recently suffered a small stroke and was in danger of having a major one.
2 arteries were already occluded, so he only had 1 carotid and 1 vertebral artery, which was supplying both hemispheres and the back of the brain. And the 1 carotid artery that he does have had some disease in it, and he had sustained a recent stroke to the hemisphere supplied by the 1 artery. That 1 artery was supplying both hemispheres, but the stroke was on the side of the open carotid artery.
Working together inside the GRMC cath lab, they placed a stent inside that 1 functioning open artery to ensure a strong and steady supply of blood to the patient's brain.
Patient was, per protocol, spent the night in the hospital in the ICU, did very well, was actually doing so well that because of an ICU bed crunch, was actually transferred out of the ICU in the early morning hours, and on post-op day 1, I sent him home at 8 a.m.
Both brothers are passionate about their work and the importance of making these kinds of minimally invasive procedures more widely available on island.
I have done carotid stenting here. We're the only shop in Micronesia that does carotid stenting, both intracranial in the brain and also in the neck. But this was the first time that we collaborated together on a neck carotid stent case.
These little mini strokes, if you will, could, obviously indicate that there could be something seriously wrong and that the patient's at increased risk for a significant stroke. So it's important to reach out and undergo a comprehensive workup.
We don't do that many cervical carotid stenting, neck carotid stenting, and I'm trying to get the word out because a lot of people can benefit from this procedure. It is now almost considered equal to the conventional open surgical repair of neck arteries. The complication rate with the protection device that we utilize, it's an umbrella that we place in the artery above where we place the stent. So if there's any plaque that breaks off, it will theoretically be trapped by this umbrella device. And with the technology that we have now, this is something that should be offered to patients much more frequently than it is here.
To learn more, call GRMC at 645-5500 and ask for the Neuroscience Department.